Hello out there, my name is Damali Musasizi. I'm here to give you a quick overview of the breast examination skill that we equip the woman with. It can be three ways. It can be as you're lying on bed, or it can be as you're standing in a mirror. Now, standing in a mirror is very practical, and this is what we are always using. So first of all, a woman under the influence of hormones will not do this technique because you will always receive confusing results. Like, let me say, when you're pregnant, when you're in menstruation, and when you're breastfeeding, you could have, let me say, when you're pregnant, the breast can pain. It could have tingling sensations, so it will affect the results of the skill. It has various notes around it, but for now, let me focus on the demonstration. So I wake up in the morning, I put off my bra, and then I'll hold my waist just above the hips. So when I hold my waist, I'll look in the mirror. When I look in the mirror, I'm looking out for the signs that my breast could portray. Let me say, is it swollen? Is it having any redness? Is there a dimpling of the skin itself? So I'm looking out for me so that I do not have to face it like this, but then I'll look straight in the mirror, and the mirror will help me see any other deviations from the normal. Then I'll raise my hand slowly as I focus in the mirror, raising my hand slowly. Why do I raise my hand slowly? I want to see if the breasts are following, if they are rising and following the motion of my arms. Whenever they don't follow, it means there is a lump inside that is pulling the skin. It's making the skin stiff for it not to follow my hands. So I'll raise my hands, just like I've been saying, to see if the breast is following. Then I'll hold my head with one hand and use the opposite hand to check the opposite breast using 3 fingers, and I use the pads, not the tips. So I'll start at the armpit side, and then I'll start palpating. First it is done lightly, and then after I get deep. I get deep as I palpate in circular motions, and I have to make sure that all the breast is covered. So when I reach the nipple, I will press back because I'm looking for the lump. It could be just behind the nipple. So I'll press back, and then I will squeeze the nipple slightly to see what discharge is coming out. And then I'll do the same. I'll do the same with this opposite breast. I will palpate deeply, and then I'll get to the nipple as I feel. Now, note that the palpation is supposed to be continuous. I don't do this. When I try to skip, it means I can miss the lump. Some lumps are movable. So I have to be continuous in a circular motion as I demonstrated it, but deep. Then after, reach the nipple, press back, and then I will see what is out of the nipple, what discharge is coming out. So various notes will be coming. Thank you so much.